Morning, Paul.
Welcome to our weekly state updates with Maura Sullivan, Director of Government Affairs at the ARC of Massachusetts. So take it away, Maura. I think we're good to go.
Okay, awesome. Hi, everybody. I'm so happy to be here today to connect. Again, I wish it was under different circumstances, but actually today feels like a good update, and we're super lucky because we have Representative Josh Cutler here from the State House to give us an update. And as a lobbyist, the only reason I can say this is because there's no other reps on the phone, but he is my favorite representative at the State House. And no, we are just super lucky to have him, a champion for people with disabilities, and just has done incredible work for us on employment and Nikki's Law, and the list goes on. So I'm going to do a short update, Rep, and then I'm going to turn it over to you and for questions and all that good stuff.
Sounds
so
good.
Go ahead. Okay, great. All right. So I also just wanted to start for sure by thanking everyone. I have to say the last two weeks, I've just never been more proud to be part of this community. The solidarity that we have shown and the way that we've all powered on here. It's really incredible to be part of it. And even more so, we had some successes because of your action and because of your ideas and because of the way we're able to work together with our community, with our provider community, and with our legislature. So thank you again. You all know about the ARC, so I'm not gonna talk any more about that, but these are some of the things we're going to talk about today. The equitable pay for essential direct care workers. I'll give you an update on that if you haven't already heard. But a lot of that thank you is going to go into that item. And I'm going to talk to you a little bit about some focus groups that Carrie and I are going to get started right away next week. And we really want you to pass the word on and to get involved because they're two really important areas. I'm going to quickly review accommodations for hospital support, since I know it's such an important issue, and once again, I think we've made some really good progress on that, and again, due to the incredible outreach that you're all taking part in. And then we'll have our update from the rep, and if we have time, I'll just throw in a little bit of what's happening on a really, really important and interesting federal initiative that we're working on with Senator Warren's office on. And if I don't get to elaborate on that, Ellen's going to cover it tomorrow. So again, get your questions ready. And of course, I'm going to share a little bit about what's been happening with my family. I shared this picture, I think, of the medications for Neil for his first 2 weeks home when I first brought him home 47 days ago. And I remember looking at these meds and thinking, oh my God, how am I going to get through the next 2 weeks? And here we are at day 48, I think. And it's day by day. I don't know, a lot of you know what pica is, but this was my week to experience the horrors of pica, where, you know, my son will put non-edibles in his mouth. So after a pretty scary incident, I had 2 nights of awake monitoring, and we're through it, but keeping it real. This is the way we're going through it, and day by day. So let's keep going. I want to tell you a little bit about these focus groups. These are the issues that the ARC has been hearing, that has been bubbling up from the beginning. Kids who are at home under 22 with significant behavioral challenges. We're going to pull together a focus group. I think it's probably going to be next Thursday, but stay tuned. Today or tomorrow, the announcements will come out, and I'd love to get as many families as possible who are experiencing significant behavioral issues at home during this crisis. We want to get your ideas, your feedback, tell you some of the things we're hearing, and just use your voice to push forward. And we know that schools are closed. We don't know what's exactly happening with summer year-round IEPs. So there's a lot to talk about. And our second focus group is going to be for adults at home or adults that are in residential programs right now and currently struggling with the isolation. We want to hear from this group. We want to be able to move forward in a way where group homes and day programs hear directly from families. So Carrie's going to head that one up, and I think in that one might come first, Carrie, earlier in the week, but we'll put that all out to you. So pass the word on as soon as you get it. Okay, so quickly, just a huge thank you. We did it together with families and strong provider community and really fast-acting legislative leaders. $44 million came into the provider community for our essential direct care workers, for PPE, for infection control, and other things. And this was just an enormous statewide effort. The ARC, obviously, we put out a template action letter, but many people approached this subject in other ways and directly to leadership and directly to their senators and reps and to the governor. But we crushed it with almost 6,000 letters that went out. And so thank you and congratulations, because our folks are safer because of this. And now, we want to ask you to send a quick thank you letter. We think that's super important, that we recognize how quickly people moved on this for us. And when we need something else, we want to make sure that we stopped to say thank you, and we will need more. Okay, so, and then quickly, more good news on accommodations for people during their hospital stay. So the best news, I think, is that we're hearing that we are at a plateau and that there is likely no need for rationing of care. And that was probably the biggest weight off of all of our shoulders to hear. We talked about that last week, but really, really important. The other things that came out to help us around supporting our loved ones during triage and hospital care is an Attorney General's guidance document that actually states that people with disabilities should have a support person. Mass General's partners policy came out and directly addresses that as well. And we have those on our website that you can take a look at. The ARC has continually been working on the crisis standards of care issue by contacting this week over 33, oops, correct me if I'm wrong, Charlie, 33 hospitals.
Yes.
Is that right? And about 75 individual leaders at these hospitals. And we've asked them to take a few minutes to come onto our website and to look at our triage training and awareness. It's a 15-minute training. It's 5-minute videos, and it shifts people back to remembering that bias does affect treatment and care, and that it has no place, especially in this crisis. So we're really feeling like, we've hit a good place with that people are starting to recognize the need for support in the hospitals, and we're continuously getting our message out there. If you are running into any problems, or you have run into a problem with accompanying a loved one into the hospital, still try to reach out to the Disability Law Center. And the only other thing I was going to mention is we have some new tools up on our COVID site under healthcare that came from Mass General's Laurie Center for Autism, and they're really great. They're really helpful around the testing, what's involved, walking individuals through it, kind of like a story. So take a look at that. And I think we're ready for Rep. Cutler. Again, just thank you so much. And we really appreciate all the work you've done in the past, and we're relying on you through this crisis.
Great. Thanks, Maura. I appreciate that. I appreciate all the great work that the ARC has been doing, especially now. Hello, everyone. My name is Josh Cutler. I'm a state rep down here on the South Shore, Pembroke, Duxbury, and Hanson. And I'm the vice chair of the Joint Committee on Children, Families, and Persons with Disabilities. I bring the good tidings of Speaker DeLeo and Chairwoman Kay Khan, who have been doing great work on this issue and many other things. So what I thought is I want to kind of just give you a quick update on what kind of things we're working on. And I would rather spend more of the time kind of taking questions and hearing your feedback, because I think that's really helpful to us to hear. But first off, just briefly, and Maura did a great job kind of bringing us up to speed. And I have to say, you know, that we always rely on the ARC, but it's more important even now because we're not able to, you know, run into everybody on the street and kind of hear what's going on face to face the way we normally would. And so we do rely on our stakeholders to really be the voice of, you know, your constituency. And the ARC does such a great job of that normally, but more importantly now. And so it is really crucial to have organizations that are respected like the ARC to be the voice. And so just want to give you guys all a great big pat on the back for all the good work you're doing. It's really important, and you're doing a good job at it. So the committee, the joint committee, we've been, the speakers asked the committee chairs to, you know, to continue to be very active during this period. And our committee has taken that instruction with gusto, and Chairwoman Khan has been hosting weekly virtual meetings like this of our committee, our full committee. We do it every Tuesday, and we kind of go through all the issues that are, you know, going on. We've also been having regular stakeholder meetings via Zoom as well with like the ARC, ADDP, MRC, the Easter Seals, COFAR, the Disability Law Center, a lot of different folks in the disability space, just to kind of, you know, same thing, kind of hear what is going on, what's going on the ground and so forth. So that's happening. From a broader point of view, just so you're aware, the legislature is moving forward with our first virtual formal sessions. I am not at the State House right now. I know my picture may not seem that way, but I'm sitting in my office. But we are going to be resuming our virtual formal sessions actually starting tomorrow, be our first one. Hopefully that will go well, and that will sort of, you know, show us the path forward in terms of resuming our somewhat normal lawmaking process. Obviously, it's still not back to normal, but that's happening tomorrow. And obviously, the next big step after that will be looking at the state budget and how we're going to reformulate our budget with, you know, a new sort of paradigm shift. And I know that will be something we'll be working with the ARC on, and making sure we're trying to protect our most vulnerable residents when we do take up what's likely to be a pretty challenging budget cycle. But so all that's happening now. Committees are meeting, we're active. A lot of Zooms. My day is filled up, probably just like yours, with a lot of Zooms with different folks, which is proving to be a nice way to stay in touch. So that's happening. Maura touched on some of the news, the good news about the $44 million the governor announced this week. That was very well. Thank you all for all your advocacy. I received emails on that, so that was good. Thank you for all the works that you're doing on that. That was really helpful. We had Chairwoman Khan and I can fill you in, had a good call yesterday. My days, I have to remember what day it is. Today's Thursday, right? Yesterday, with Acting Secretary Sy, who's filling in for Mary Lou Sutters, who's doing such a wonderful job as our Commander Sutters, now running the command center for the whole state COVID effort. And I have to give kudos to them. You know, they've been super responsive throughout all of this. The governor and his team have really been very responsive to the concerns that we've raised and that you have raised. And I think they're doing everything they can to address them. So, you know, really, it is nice. Obviously, none of us want to be in this situation, but it is nice to see the, you know, sort of level of cooperation and with this idea, you know, we're all in this together. I think that really has, you know, been the case. And so it is nice to see. So I wanted to just publicly to thank them for all that they're doing, and Secretary Sutters and Acting Secretary Sy have been really responsive to us. So I can fill you in, you know, some of the things we talked about were yesterday in our call were data issues in testing, because that is a concern. I think, you know, I hear from folks, we want to get more data out to everyone and to the public about what's being done in congregate care settings for testing. We were told yesterday, I don't know if this is breaking information or not, you may already be aware that as of yesterday, 882 sites, DDS sites, had been tested, and that approximately 9,500 tests were administered. Wow. Fallon Ambulance is the partner that's handling the mobile testing, and they still obviously have a significant number of people. There's about 25,000 folks who are in congregate care settings statewide. That data includes staff and residents. So that was the latest we were told. We've asked them to consider putting up a more regular update as we do with long-term care facilities. We think it would be important to have a little more transparency about data in the congregate care testing facilities. So we have asked for that. What else? I know one issue that came up that Maura touched on was this issue of hospital access when folks have loved ones that are in a hospital. What the policies are in terms of getting in to see someone if they have a PCA and so forth. And one of the pieces of advice that we were given, and I guess throw this out there as well, is that if there are specific instances, and it sounds like a lot of hospitals have already taken some steps to adopt good policies here, but if any of you have instances specifically of potential issues that you've run into in area hospitals, to please let us know directly in terms of the specific hospitals and specific facilities. They wanted to have that data so that they could reach out, and deal directly with any hospital and make sure that they do have a consistent policy. So that was one ask that we were given, was that if there are hospitals where you folks are running into that problem of not gaining access to loved ones, to please let us know directly, and feel free to reach out to me offline or through the ARC.
That's great. That's great to hear.
So there's that. We still have the committee is still moving forward on legislation. We just reported out a couple bills dealing with parents as PCAs. I know that's an issue that the ARC is focused on, and those did get an extension order, so that we'll still have time to review those in healthcare financing. So that's really the I guess the quick summary. I can pause here, and if folks have questions or more, if you think I've missed anything or should bring up something, please maybe jump in and let me know.
Absolutely. I'm sure there's questions in the chat, but you can also
let me look at the chat. I forgot to look at the chat here.
That's okay. That's okay.
There we go.
That's okay. I know this is Carrie. Christine Hubbard had a couple of questions. Christine, do you want to, you can either unmute yourself or I can read them.
Hi, Christine.
Hi, Representative Cutler. Thank you for joining us. Yeah. I just had a couple of thoughts, two of which are future looking. Okay. One of which was a question about anything else you could share about next year's budget, and maybe just how bad it will be, and if it will be ameliorated if the feds come through in the next package. But I don't know how much you could tell us about that. The other thought was, again, in the future, after we're past this, if there was any thought for having a state stockpile of PPE that would be available for the human service sector to tap in the future. My son is in a group home, and his agency has spent enormous hours during this searching for PPE and running up an enormous cost getting it, and then we've been assembling it, and it's been like a huge mission during this time, which is challenging just in terms of the care of the individuals, let alone becoming distributors and finding supplies of PPE. So the thought would be whether instead of, because I don't know how reliable the federal government is on this, but given the experience.
No comment.
So just the thought that maybe that, down the road when we come out of this and we come out of the financial crisis that follows, that maybe that would be something that from a preparedness standpoint in the state would make sense. And then the last, I just wanted to report, we had a Zoom meeting last night, which we have weekly with his agency, and it was interesting on the testing. What they're finding is for staff being tested, and they have several houses that have gone hot, as they say, whether it's staff or residents. But in terms of testing, it's been much easier for the staff to get tested through their PCP, particularly staff who live in Rhode Island, because of CVS being headquartered there. You can actually now in Rhode Island do a drive-through. You just have to schedule an appointment. You don't even have to have a doctor schedule it for you. And they find they can get tested within a day versus the mobile testing is still taking several days to schedule for the mobile testing to come to the home. So it's not, as a practical matter, it hasn't so far been, proving to be the thing of first choice in terms of speeding up the determination of when there is virus in a house. So I just thought I'd share that.
Sure. Yeah. Well, so let me try to touch on all three of those topics. First, on the state budget. We've had, I happen to sit on the Ways and Means Committee as well. So we've had some discussions about that, and not to get too far into the weeds, but Maura knows usually in a normal cycle in January, we have our what's called consensus revenue hearing, where we hear from state experts and economists and so forth who tell us what they predict revenues will be for the next fiscal year, and that's the number that we use to then back into our budget, essentially knowing how much money we have, new revenues we have to spend, and where then we decide how best to allocate them. So obviously the number that was given back in January for revenues for FY21 is probably a little off by now. We've had some significant changes. So, we're sort of back to square one on that. So what happened is we had another consensus revenue hearing that was held, I want to say last week, although again, the days are now mixing together, to hear again from some of the same folks with new predictions about, what we see the state economy looking like for the next fiscal year. Now, you can imagine it's a little bit challenging to do. We're still in the midst, or somewhere past maybe half court, but still in the midst of this crisis. But they did proffer some predictions or expectations, and I would say that there's 4 letters that they use, and I will describe them all. You may have already heard some of these used. One is the V, the V-shaped recovery, where we bounce back very quickly and fully, which is what we all hope. The next is the U-shaped recovery, where it bounces back, but not quite so quickly or dramatically, and takes a little bit more time to ramp it back up. Then there's the L, which is not the desired outcome, which is where we have a flat revenue for a significant amount of time. And then the letter that I didn't expect, which is the W, where we have a double whammy, so to speak, where we have a sort of double downturn and an upturn. So those are the different, to sort of simplify, really smart people talking about the economy, which is not me. That's what they told us. Now the fiscal impact, is all over the map a little bit, but the data we're hearing is anywhere between, $3 to potentially $6 or $7 billion revenue shortfall for next fiscal year. Obviously, we have a couple things going for us. We have a very sizable rainy day fund in Massachusetts. We have done a good job of replenishing we call it the rainy day fund or stabilization fund. It's over $3 billion. And we have done a good job the last few years of building that back up. So that is something that can help sustain us during this time. Obviously, if there was ever a day to tap into the rainy day fund, it's now. It's raining. That's not going to be a cure-all, of course. And the other thing is federal funding. We're hopeful that there'll be additional federal funding. We've already gotten some funding through the CARES Act. There's talk of another round of funding that would give more money to states. We're obviously very hopeful about that, and we know our federal delegation is working hard on that. Senator Markey and everyone else down the line. So I guess that's a long answer. I can't tell you yet. It's in the progress. We're working on it, and it's going to be challenging for sure. But that's going to be where it's going to be important to have voices like yourselves and the ARC to make sure we try to do everything we can to make sure that there aren't any there's no harm that comes to our community. In terms of the PPE, I forgot the original question, but on the stockpile, right? So yeah, that is a great idea. I'm sure that's already come up. If not, once the immediate issues, the acute issues subside, I'm sure there'll be discussion about what do we do for the next time, and that will be high on the list. I think we've all seen the need for access to PPE. It's been along with the testing, those have been sort of the key stumbling blocks in a lot of areas. So I'm sure that's a great idea, and I'm sure greater minds than I have thought of that already, but if not, we'll make sure that they do. And then on the mobile testing, we did have a chat about this yesterday, and I've heard different points of view, and I'm happy to hear you all. I understand from the mobile testing program that what they're trying to do is let folks at the facilities know a little bit ahead of time so they can have their staff come in and get tested, because obviously it's one thing to test the patients, but if the staff isn't getting tested, it's sort of meaningless because the staff's coming in and out, and they're probably the more likely to be the carriers, frankly. And so they are trying to get advance notice. I've heard somewhat conflicting details about how much notice that is and whether that's working out in all scenarios. I understand it's an imperfect system, and you can't always give enough notice to everyone to kind of come into work on a day when maybe they're off. So those things are, I think they're working out some of the kinks there. But that is happening. And, in terms of the testing, obviously, in CVS now, they do have the CVS does have a test up in Lowell. You can go and book online. You do still need either to have some symptoms or a doctor's recommendation, but folks can do that and get the instant, half hour later results from that. So it's definitely recognition that the testing isn't perfect yet. The other issue that we had chatted about is that this need for retesting, because obviously just testing once is great, but that doesn't, you need to retest. And so we don't really have a system right now to retest. So that's something that I know was raised on our call yesterday. And I know that HHS is aware of this and, looking at it. I think like everything, they're trying to, come up with a plan to address that. We're not there yet, but I think there's definitely an acknowledgement that needs to happen, that there needs to be some sort of process for retesting. So that was the long answer. Hopefully I addressed the three things that you raised.
Definitely. Josh, I would just jump in quick to ask, the retesting is huge, but we're hoping that at some point there will be some kind of antibody testing. And obviously we just want to make sure our community is prioritized, because like in hospitals, it's really hard to contain, the coughing. People aren't wearing PPE, because of sensory issues. And if we knew that there were staff that could go in that, had antibodies to this, obviously it would be so much safer for them. I don't know where that is, but I just want to keep raising it as like, we need to be considered essential in that way.
Yeah, I agree. And I think, part of that gets back more to the idea of the data and the transparency of the data, because I think if they were more, we don't know. One of the questions I asked was just, about some of the data related questions, and we don't necessarily know as much. We certainly don't know as much about congregate care as we know about long-term care facilities, right. Not by a long shot. And so I think if we had more data, that would help, A, to, maybe allay some anxieties that we have, or B, maybe it would shine a light on where there's a problem that we need to root out. But also I think it would raise the profile, a little bit and accomplish what you're talking about, is to make sure that, moving forward, that the community is not, is fully, prioritized.
Absolutely.
So it's back to getting the data out, I guess.
And in terms of the data, we had some difficult questions to ask around data this week too, because the data is all together on long-term care and congregate facilities, and we're seeing this incredibly high death rate. 44% of the deaths are related to long-term care and facilities. And what we would like MEMA and DPH to help us with is to say, out of that number, which number is over 65, because that, we need staff, and nobody wants to come to work at a place where half the people are dying. And it's a terrible question to ask, but data is so critical. We need to know how it breaks out in those facilities specifically. So this is going to be a big need for us to look at data, and we'll be pushing that. Yeah,
I absolutely agree. I think we made that clear yesterday, and we, obviously we're not there yet. So it's something we have to do better at.
Awesome.
So this is Carrie. I know that Jossie had, you had your hand raised for a while. I unmuted you, Jossie. Would you like to ask a question?
Yes, I actually was related to what Christine was talking about, the budget, because it got me thinking, because I was reading this morning about Senator Warren asking for, I think it was $50 million for HCBS. And I was wondering, if that doesn't work on the federal level, and could we do that on the state level? Make sure that there's more money put aside, at least on the state level, for HCBS. That's what I was, put that on the radar.
Okay. Yeah. No. Obviously, we would welcome any federal support we can get in any way. Certainly, and appreciate Senator Warren doing that. It's going to be, to be very candid, it's going to be challenging at the state level. Unlike the federal government, we can't spend more revenue than we bring in. And so we have to have, somehow have a balanced budget. So we're going to rely on the federal government to help. There we go. To help support that. But I appreciate that, and certainly I'm happy to forward that concern and idea along.
Couldn't the rainy day fund help? Maybe.
It could, yeah. Yep. Yeah. I mean, the rainy day fund, we have broad latitude about that. Now, there is a concern, or not concern, but we have to keep in mind that the Commonwealth has a credit rating with different credit rating agencies, not to get again too far into the weeds here, and part of that, keeping a high credit rating, which allows us to borrow money, which allows us to do things, like when we need to bond at a low rate, is because we have a rainy day fund. And if we were to, spend it all, I'm sure that would impact our credit ratings and therefore raise the cost of borrowing, which in turn would make it harder to come up with funds for some of these things. So it's a bit of a trade-off, but certainly, there's no doubt that we're going to have to rely to some extent on the rainy day fund, for sure.
Yeah.
Thanks.
So
okay, thank you. Did you see the question from Glenn, Maura?
I did, and
okay.
It ties into this next slide as well, but also
yes.
to what Rep. Cutler was talking about in terms of bills. Of course, I am really interested in learning, how are we going to get bills passed this year? We worked so hard on so many of these bills. All of you guys have been writing letters and coming to testify. And, is it a possibility that bills are going to go through that are not COVID related or super high priority?
Yeah, so that's a good question, because that's been on my mind as well. And so I think, here's what I can tell you, and I'm just speaking for myself, just to be clear. There's different chatter. Obviously, in a normal cycle, we would be finishing up our formal sessions by July 31st. I think there's, I don't think I'm going on a limb by saying that's probably not going to be the deadline this year. I think there's going to be some sort of, extension of that, because we have to get the budget done. Again, I'm just kind of speculating here, but I think there's a good chance that we might do what we call like 1/12 budgets, where we're doing proportional budgets for a certain period of time to give us more time to see the revenue impact. Because obviously the worst thing to do would be to bake in a bad budget, in May and then have those numbers not, come out. So, having more time to see the data is going to be helpful. So I think you may see a proportional budget, for the first few months of the fiscal year, and then an attempt to have a budget for the rest of the fiscal year, number one. So that's going to require some flexibility with our regular deadlines. I think number two, I think, I think we've had a fairly productive session so far, but obviously there's a lot of key bills that are still pending in different, stages. And I have some bills I'm working on too that I'm anxious about.
Mm-hmm.
I think once this formal session is worked out, and we're having, again, our first one tomorrow, Friday. Once we've done that and had our first virtual, formal session and worked out how we're actually going to be voting on stuff and, what the mechanics of that are, and gotten the kinks out. Mm-hmm. I think once that happens, and we've done it a couple of times, then I think there'll be a little bit of a shift in terms of, okay, well, we got to get back to doing our work that's not COVID related.
Right.
And I think at that point, we may see that happening. It's going to be a slow transition, I think, because again, it's going to, the budget is going to be the big elephant in the room, right. And anything budgetarily related. So if it's legislation that has a fiscal impact, I think that is going to be more cautiously looked at. Yeah. But things that are not COVID related and not fiscal directly impacting things, then I'm hopeful that maybe not immediately, but more towards the June timeframe, that we'll see some more traditional lawmaking happening. I can tell you that the committees are active. I get, emails all day, like you guys probably do, from different committees saying, there's a virtual hearing happening. In fact, I'm proud to say I think the first ever virtual public hearing was held by our committee, the Joint Committee on Children, Families, and Persons with Disabilities. We held one like 2 or 3 weeks ago.
Yeah.
Take testimony. And we did it just like this, and the public could zoom in and take testimony. And frankly, it was pretty good, I thought, and probably a good model to follow when this is all done, because it allowed people to weigh in who, maybe couldn't have come into the State House. Yeah. So there are some positives, but anyway, that's happening in the background, and different committees are meeting, not in person, but meeting virtually, and people are filing testimony and stuff. So we're certainly not at a standstill. In fact, in some ways, there's been I'd say a high level of productivity. There's been a number of pieces of legislation that have been produced that the governor has signed. So So anyway, it's happening. I think, the return to normal bills is probably going to be take a little more time, but I think, I don't think I certainly would not rule it out for sure.
I would ask a question about when you say non-COVID related bills. It seems to me that they're probably, at least I know on a national level, they're bills that aren't directly related to COVID-19, but that would help with what COVID-19 has revealed. Like their Social Security bills, for instance, or their HCBS bills that aren't directly, they were introduced before COVID-19, but they would certainly help with COVID-19.
Yes.
So I mean, those are bills that aren't COVID-related bills, but aren't they bills that could still be looked at because they deal with issues that are highlighted by COVID-19.
Great. And Jossie, just to jump in there, specifically the question that came in from Glenn and this slide and what Rep. Cutler mentioned earlier was the PCA bill, so allowing parents and guardians and spouses to be PCAs. This couldn't be more timely. I mean, it's ridiculous that we can't do this while we're all doing it 24/7. And so you guys got that through Children and Families, and now it's waiting for the next committee. So if there's a way we can just do our advocacy as, yes, this might be a bill that was there before, but it's even more critical now, and it may be more critical, it will be more critical in the future. As our workforce is diminishing, as we may have more occasions where we're going to be home, with any kind of resurgences. And we were lucky yesterday and the day before, I think we started to work with Senator Warren's office on adding language to the package that she's working on, the fourth package, which is going to focus on disabilities. And Jossie had mentioned the 50 million, and there's a lot of other really great pieces in the fourth package that we're, going to need a lot of advocacy on. So head over to the ARC-US and put in your action items there. But this would be a great opportunity to add language to allow PCAs, and not just that, but to end the discrimination against those who need prompting and cueing, which is another bill that was in your committee. And it gets out every year, but it doesn't go forward from there. So another one that we, would be, dually helpful in the long run, but right now it would be really, really helpful. So the ARC is working with a couple of organizations. What's so great is we're finding organizations we don't typically work with, but we're able to unite and work on some similar issues. So working with, we always work with the independent living centers, but really specifically on this and the United Spinal. And so whatever we can do to get state and federal coming at this issue would be great.
Yeah, no, absolutely. And just for benefit of folks who may not be as familiar with it as you, Maura, the PCA bill was reported out of our committee and is in healthcare financing. They did get an extension order to June 19th. That's sort of insider baseball, but typically we have deadlines by which bills have to be reported out or they get basically put into study. But that deadline was extended out to June 19th. So there is some time for that bill. Obviously, there's a lot of good legislation that doesn't always get to the finish line. Mm-hmm. Not to be, so we have to be realistic about it. But I think to the point that was made, definitely. Not to be opportunistic, but the fact that there is a COVID-related hook, is helpful because we're really looking strong at all things that are related to COVID right now. And so if this is an idea that and the administration is as well has been very flexible and adaptive to what's happening. So this, I guess, what is it? Crisis and opportunity. It's the same word in certain languages and so forth. So I would say that's a good example of it. Trying to use this for that piece of legislation.
Absolutely. Well, I'm not sure if we have any more questions. I didn't see any. Did you see any, Carrie?
I wanted to just say more.
I think we're set with the questions. Thanks.
If anybody, my legislative aide Cole is on the Zoom here, and maybe he can throw in his email address here to the chat. If anybody has a question that they didn't get to, or maybe just wanted to ask us directly, feel free to reach out. And if I don't know the answer, I'm happy to do that. So Cole, if you're listening up, he already did. Look at that. Great staff. Thank you, Cole. He's put his email address there in the chat. So.
Rep, thank you so much, and thank you, Cole. You had mentioned earlier that you thought that the command center and Secretary Sutters was doing such an amazing job, and I would agree that we have all been able to have a level of trust in our state leaders that we don't have in our federal government, but that's because of people like you that are transparent and willing to speak to us and really listening. So I really appreciate all that you're doing and your time today, and maybe we can check back in again in a couple weeks.
Happy to do that. Sure. Thank you.
Thank you.
Everybody.
Thank you, everybody.
Thank you.
Stay well.
You too.
Bye-bye.
Bye.
Bye, guys.